well, healthcare is a human right more than a privilege, because when people get injured or sick, like, it's a priority to help them and to like provide them with a service that they can rely on because it's like a life or death situation in some cases. Like, some people can't afford healthcare, which is really expensive, or private healthcare in some countries because the system is different, but they can't afford it. So when they have like a very serious disease or an injury that cannot be like just ignored, they need healthcare, and they could die because, well, it's not like provided to them as a right. It's a privilege. You need to have a lot of money to have healthcare, actually.
I also think that it should be a human right, because as humans we deserve to have healthcare, even so we cannot access to them somehow. Some people and cannot access to it, and it's really sad because it's just the white privileged people that can access to it because of the money, the social position, and lots of things that should not be a reason to have a good health care. And we should do something about it and not just pretend to be blind at this situation.
Okay, but I really want to say that healthcare is a privilege. Maria said it, not people can afford it. So having the money to pay for your treatments or medicine is really a privilege. It should be a right. It is a right, but really it's a privilege. Many people can afford a good doctor, or even the test like MRIs or etc. I don't know about a lot of medicine, but what I know is it is really a privilege. Many people die because they don't have the money for paying their medicine, or maybe there's not a doctor in rural places. Really, when you think about it, when you go to the doctor, you think it is a privilege that I can afford this. It is a privilege that I have a good doctor that can check all my diseases. Maybe a lot of people even didn't have access to vaccines. Many babies die because of that. So I really think it is a privilege. I know it should be a right, but nowadays it's a privilege.
I agree on the part that, well, it is a privilege, but I think that it should be considered as a formal human right, because healthcare is a need. People need it. And I agree with the part that we have to pay. Like, we have to pay something to the doctors for the test, for the equipment that we are, well, like, provided with. But I think it should be like a really small amount compared to what we really pay for healthcare. It's insane. It's so expensive, and it should not be that way for something as serious as our health, in my opinion.
Yeah, I think that it's not the doctor's fault, because they did not choose, like, you don't study for years to just get paid a small amount of money. And I think it's a complex problem than just saying that the doctors are the bad people. No, they are trying to save people's lives. But I think it has to do more with the topic of poor people, and how in this world we are not equal. Some people, like us, for example, we study in a
Private school.
in a private school, We cannot like talk much about this, but we can start to
Like spread awareness.
spread awareness, because as teenagers we cannot do much, but we can make people hear us, and the people that need this the most need to be visible and equal.